This is a Thai TV5 program about cerebral hemorrhage, 6 March 2012. Subject: cerebral hemorrhage in patient aged 32 years. Case study: Narong Panaligun. People who work very hard often forget how important it is to look after their own health. Here we have a case study of a man aged 30 who worked very hard every day and did not look after his health until he had a big problem with a coma. Resource person: Pantipar Vashalobun, President of Biomolecular Therapy Clinic Asia; Dr. Prasit Patanapanish, MD, Director General of Biomolecular Therapy Clinic Asia. Invited patients: Tanigan Gaunet, Narong Panaligun's sister, telling his story. TV interviewer Sepsagun Pandi. Today we have come to talk about health with the Biomolecular Therapy Clinic in Bangkok, where we have a very interesting case study about Mr. Narong Panaligun suffering with cerebral hemorrhage, aged only 32. Mr. Panaligun came here for biomolecular therapy, and because of this his relatives now have increased hope, as he can already react to questions by answering back. Who can get a cerebral hemorrhage? Also, what are the symptoms? And is there now hope for the patients, or is it hopeless? Dr. Prasit Patanapanish. This case is related to blood vessels in the brain and is caused mainly by an abnormality in the small arteries called an aneurysm, or by long-term high blood pressure. In this case, the patient was not aware he had high blood pressure, or maybe it was caused by a partially blocked sclerosed artery, i.e. fat deposit buildup in the artery may cause it to break. These types of symptoms are called stroke and can be acute and severe. In general, the symptoms are paralysis due to a blood clot at the point of breakage that presses on the brain tissue, causing death. The majority of patients, about 80% with severe symptoms, die in the first week, and if the patient does not die, then there is always paralysis and inability to speak, loss of perception and visual impairment. TV5 interviewer Sepsagun Pandi. Are the symptoms the same as Dr. Prasit explained or not? Tanigan Gaunet, Narong Panaligun's sister. Very similar symptoms with sickness and not feeling well. He just took tablets for fever and to relax, and then when he was called, he was in a coma. Dr. Prasit Patanapanish. Before, did he ever have a headache or not? Tanigan Gaunet, Narong Panaligun's sister. He did not have any symptoms for a headache. I took him to the hospital, where the doctors found during an x-ray that he had a cerebral hemorrhage. The doctors told him he had a 50% chance of living, and his mother took him for treatment in Bangkok, and we stayed in Pathum Thani. TV5 interviewer Sepsagun Pandi. What were his symptoms? Tanigan Gaunet, Narong Panaligun's sister. Doctors in the hospital in Bangkok carried out a tracheostomy, and he had to stay in the ICU for 2 months and use a respirator. After 2 months, he could stop using the respirator, only wanted to sleep, did not know anything and could not move. TV5 interviewer Sepsagun Pandi. After starting the treatment, how is he now? Also, how long has he taken the treatment and what symptoms have improved? Tanigan Gaunet, Narong Panaligun's sister. He has improved. He has taken the treatment about 1 month and he is already seeing improvements. TV5 interviewer Sepsagun Pandi. What improvements has he experienced? Tanigan Gaunet, Narong Panaligun's sister. 2 to 3 days after biomolecular therapy treatment, he looks fresher, can open his eyes, but cannot look left or right. Also, he cannot register a picture held in front of his eyes. When the doctor makes an appointment, we always come. Also, he takes the tablets continuously. After 1 week's treatment, he can start to turn left and right. Also, when his name is called, he turns his head. TV5 interviewer Sepsagun Pandi. So he starts to listen and acknowledge things. Tanigan Gaunet, Narong Panaligun's sister. He can now clench his fist very hard. TV5 interviewer Sepsagun Pandi. For the last 2 months, he cannot do this. I must ask teacher Pantipar, how do you treat people who are sick like this with biomolecular therapy? Pantipar Vashalobun. He starts to get well respectively, starts to open his eyes, is joyful, does not sleep all day, sleeps normally at night, starts to register what he sees and starts to look at people. People can also see how much more he has gotten better. This is a disease where before treatment he could not register things and showed no signs of getting better. It is certainly very good that he can now look for a long time, remember and register things like who this is, etc., but he still has no voice. When the brain gets better and the nerve vessels that go from the arm to the brain get better, we provide all treatment that is necessary. We restore the damaged parts of the brain, including part of the cerebellum that controls the eyesight. In addition to this, we provide an holistic treatment for the whole body, including the brain stem, whole brain, veins, arteries, nerve vessels, kidney, liver, intestines, immune system, and heart. This is because he sleeps a long time, can easily get infections, and cannot exercise. Our biomolecular therapy treatment methodology revives and develops the damaged parts of the living cells very effectively that cannot perform their duty, causing the cell functionality to increase. Even if the cell is severely damaged, we can restore this to wake up and start running again, to once again look after the tissue. Our treatment revives the brain cell, and when it is sufficiently strengthened, it divides by 2. Some people still argue that in theory it does not divide, but the brain cell can be further developed by 5 to 20%. This we are certain about. We are very glad about this case where his relative told us that he still has a small child that we pity, and now he can lavish his child once again. TV5 interviewer Sepsagun Pandey. Today we wish Mr. Narong a strong willpower to get continuously better, also a strong willpower for his sister who is looking after him. Contact details. Please contact us for more information, or if you would like a consultation and help regarding your own health problems at email vitorganinfo@gmail.com. vitorganinfo, one word spelled VITORGANINFO. Telephone +66 outside Thailand 86 386 8822 or +66 287 409 80 or +66 865 096 666 or fax +66 287 409 85. Our address, Biomolecular Therapy Clinic, 30/8 Moo 1, Moo spelled MOO, Soy, Puthabusha 5, Soy spelled SOI, Puthabusha spelled PUTHABUCHA, Puthabusha Road, Bangmut, Jomtong, Bangmut spelled BANGMOD, Jomtong spelled JOMTHONG, Bangkok 10150, Thailand. We also have a website, worldwideweb.biotherapycenter.com, Biotherapy Center in one word spelled BIOTHERAPYCENTER. We look forward to hearing from you and helping you with your problems. Thank you.